Let's just talk a little bit in general about COVID-19 testing per se. So what are the various tests out there for COVID-19? The first test which we have seen in media that we didn't have enough of is the PCR testing. Now the PCR testing is to see if someone has a virus. So you can go through the drive-through or in the hospital, in the emergency room, or in the labs, and they put a swab up your nose, and they look for the actual what's inside the virus. They amplify it, and then they see if you have it. So that's the PCR testing to see if you have active virus. And there's some false negative if you do it early or if you don't do it properly. And then the rapid testing from Abbott came back recently in 2 weeks, which is fantastic. Hospitals have it. I wish we can do it too, but there is a little bit issue with collecting the samples in a special chamber. It get aerosolized, so unfortunately the ambulatory practice don't have access. But it has been found that it's about 10% not as accurate as the original PCR. So we're still talking about the actual virus material testing, whether you're infectious. So that's one, which has been there for a few weeks and getting more ramped up in the production. The exciting news in that era is the MIT, which came out last week with a test called STOP, S-T-O-P, Sherlock testing in one part. Very interesting. They are looking to, like we do dipstick for pregnancy tests, that kind of material. It's a CRISPR technology and different than the PCR. And I think once they get FDA approved, that will be the testing which, in my opinion, every employer, high-risk employer like nursing homes should have or any big business where they are in touch with, like grocery store, a lot of employees, and they are interacting with a lot of customers. The advantage of that test is, as I said, is dipstick. So you can do through saliva, you can do through nasal swab, and you can see if the employee, and it's quick, it's within an hour. So you can see if the employee has it or don't have it, especially in skilled facilities. As you can see in the news, a lot of nursing homes in Florida, especially in Pinellas County, we have a lot of nursing homes and seniors, and they are high risk. And we've seen what happened in Freedom Square community. Unfortunately, one or two, spreaders, heavy spreaders, and we have a lot of cases. And I think about 20 deaths or that in that ballpark in St. Mark's in Palm Harbor, and just one death recently in the Bardmore Oaks nursing facility. I think nursing facilities should, I was just talking to, since I'm a medical director at Clear Choice, East Bay Rehab, thank God they don't have any case yet, but I was talking to their administrator, and the ACA, the administration which controls the rules for skilled facilities, have put in place that every patient coming from the hospital should have a COVID negative test, PCR, again PCR. So that's a good thing that they're not going to bring it, but there are employees, there are visitors. So far the visitors are not there, but there are vendors. So I think all of them should get it done every day, because we got a very vulnerable population inside, and once it goes inside, there's no fault of any facility. It is the nature of the droplet infection like we've seen in cruise ships, and the nursing facilities or skilled facilities are like a cruise ship on land. So I think the CRISPR technology, the MIT is coming out, the dipstick one, it's like, will be a game changer for preventing the same day testing. Now let's talk about the other testing, which I know the main question is now, which got rolled out in the last couple of weeks. And you've probably seen everyone, urgent cares, and a lot of advertisement going on, that $25, $100, you can do direct consumer advertisement. So what I read, and there was a big article, and we'll put a link for that, from Infectious Disease Society. They came up with recommendation for the antibodies, is that it is you got to be very careful. So let's break it down. So the antibody testing, first thing is the vendor. So FDA gave approval to 12 vendors. Now, after that, they got scared because they got burnt in, not getting the PCR virus testing out early. So they got scared and they said anyone can get emergency approval, or they call EUA or something like that, where they can offer the testing and they can come back and get the validation later for the antibody testing. Oh, that was very dangerous. There were 200 companies jumped into the fray thinking it's a next gold rush, and they started applying for, or saying, hey, we have FDA approval. They didn't have FDA approval. They just had an emergency order and said, go ahead. Now, the FDA realized that it's a dangerous situation last week, and they said, no, only you got 10 days, those 200 companies which started offering these tests, to come back to us and show us your specificity and sensitivity. So let's be very clear. The antibody testing, if they are not FDA approved, please do not do it. This is the problem with that. If you get, let's say, IgG, so let's talk about that. What do they test and how do they test? So there are different ways. The most tedious one, which is the most sensitive and specific, is the ELISA method, ELISA. So that method, if a company is doing it and has a FDA stamp, then you are assured that the good sensitivity and specificity. Roche came out with a test just, I think, 2 days ago, which got FDA approval, is 99.8% specific and 100% sensitive. Now, that's a good test. That's a fantastic test. Now, let's say, you were smart enough, you didn't fall into the trap of going to someone advertising for $25 and they're not FDA approved. Let's say you were smart to pick a test which is FDA approved. Let's say you did that. Now the question comes, what you do with the results, right? So let's talk about that. So what are the results going to be? There are two kinds of antibodies which you can detect. One is IgM, which comes first, and more importantly, the IgG one, which comes after a week to 2 weeks. That's the antibodies we're looking at. Again, you got to be very careful, and the problem is we don't have a control group to compare the data. What I mean by that is coronavirus, COVID-19 is not the only coronavirus. There are a lot of cold viruses which are coronavirus too. So then there could be a cross sensitivity to these viruses, and you can have IgG antibodies to a different coronavirus which can contaminate your IgG results for the COVID-19. So now you get that false positive test from the other coronavirus, and you feel good. Hey, I got exposed and I'm immune and I can do whatever. Or you take the other scenario where your tests come back negative. You don't have IgM, you don't have IgG, you go out hugging and shaking hands with people saying, hey, I don't have a disease. But, that's a false sense of security. You're relying on a test to give you a true positive test, and it may not be true positive, that it failed to diagnose that you got exposed, and you may be in the early phase of it. B, you may get it in that time frame. So a lot of people were touting these to be a immunity passports kind of test where you can put the workforce in place by having a positive or negative test with antibodies. That's not what the Infectious Disease Society is saying. I think the main role for the antibody testing going to be for seeing how much population was not diagnosed and was asymptomatic. So, for example, there was a survey done by Governor Cuomo in New York City, which is the hotspot, and they found about 20% positivity on the antibodies. People walked into grocery stores and they just checked their random, I think 3,000 tests, and they extrapolated to 20%. Now, there is value there. Even if you have false negative or false positive, you keep that into consideration, but you're not giving an individual a passport to go out and do whatever. So there is value in research for vaccine. I'll come to that in a minute. So if you give someone a phase 2, phase 3 vaccine, and then you test them for immunity, that's where the value of the antibody testing is. So yes, we have the tools available. As I said, LabCorp and Quest is saying for $100 you can do testing through them. But what you do with the data? Testing is the easy part, but what's the value of the data? That's the critical part. And importantly, so far the scientists, and since it's a newer disease and we don't have the full cycle of exposure, the scientists are unable to tell us that if you get even a IgG immunity and with a good FDA approved test, will it protect you? The answer to that question is we don't know. So if we don't know even the IgG immunity with a good solid test going to protect you from a reinfection, how good is the value of doing a test? So my suggestion to the folks who are itching to do it because the curiosity, whether they got exposed or they had flu-like symptoms 2 months back and it was flu negative, what can they do about that? Whether it's COVID, sure, it probably was COVID, but what you going to do with the knowledge? So that's the critical question the scientists have to come up with the answer for before we do large-scale antibody testing. So that's my 2 cents on antibody testing.